The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome everyone. We are gathered here for the next episode of TMD Demystified. I am Tony Urbanek. It is Tuesday morning when I usually record these episodes in beautiful Franklin, Tennessee. Today's episode is entitled TMD, the World's Most Misunderstood Disease. And I firmly believe that is the truth. Being both a dentist and a physician and familiar with walking both rails in the healthcare system, along with being a researcher myself with a degree in cell biology and anatomy and experience as a fellow with the NIH for 2 years doing my own research project in facial growth and development, I'm familiar with all varieties of the disease processes, and hopefully my medical and dental training familiarized me with the vast majority, at least, of diseases of the human body. And I must say, having that familiarity, I firmly believe that TMD is the world's most misunderstood disease. This disease, and it is a disease, and it is a single disease. When you understand what creates the disease, you can easily see that and is represented no matter what portions of the academic world tries to make you believe it's multiple diseases. It's not. TMD is a single disease. The disease is inflammation within the temporomandibular joint. That's the disease, inflammation. And inflammation creates each and every one of the disparate symptoms. But even our current educational system, our dental schools, and our quote unquote researchers and authors on temporomandibular joint disorder want to make it multiple disorders. I believe because they just want to make it complicated. If it's complicated, it's worth more in prestige, worth more in money if it's more complicated. But it's not a complicated issue. And this disease goes back a long way. It truly does. I had the thought, I wondered, because I had known that the gnashing of teeth had been mentioned multiple times within the Bible, and I actually asked AI, I'm going to share my screen, to quote passages within the New Testament that talked about gnashing of the teeth. There are actually, I believe, 2, 4, 6, 7 of them in the New Testament, and there were another several in the Old Testament talked about gnashing of the teeth, bruxism. So this is not a new disease. It is not a new problem for man, and it's been going on a long time. It has only been addressed to any great degree within the past 50 years. And that is the length of time that I've been practicing as an oral and maxillofacial surgeon. And as those of you who follow me know, that I practiced surgery on the temporomandibular joint for the first 36 years of my career, and then decided surgery was not going to be the long-term solution for this problem, and put aside all my bias about the problem, bias created by listening to my colleagues and reading the literature and reading textbooks and going to congresses and going to meetings. And I put aside all of my biases and did my own research. And what I found rather rapidly was that by allowing the joint to rest according to a protocol long enough to allow the inflammation to go away, all the symptoms would be kept at bay. Enough inflammation would be decreased where the symptoms would be decreased by a little device that separates the back teeth according to the protocol that my dental colleagues are fearful of because they're so terribly fearful that you get posterior supereruption of those teeth in the back, which really doesn't occur at all in adults if you follow the protocol. Yes, if you wear it 24/7 for 2 years, you're going to get posterior supereruption, but in 2 months, it doesn't happen. And that's why the protocol is designed the way it is. 2 months, 24/7, nighttime only, the rest of your life. And that is enough rest for the temporomandibular joint to allow the inflammation to decrease. Just like a set of crutches works on a knee or a sling works on an elbow, you rest the joint, the inflammation goes away, the symptoms go away. And the disparate symptoms of TMD, we all know, are very disparate and widespread. Frequent or recurring headaches, earaches, jaw pain, neck pain, ringing in the ears, fullness in the ears, like subjective hearing loss, vertigo, dizziness, upper back and shoulder pain and tightness, arm, hand, finger tingling, and numbness of various kinds and various kinds of jaw locking. It is a big problem. 45% of females in the United States of America have temporomandibular joint symptoms. And the biggest part of the problem, it's misdiagnosed by my medical colleagues constantly as migraine headaches, Meniere's disease, and ear infections, because ear pain is one of the primary symptoms, ringing, fullness, dizziness in the ears, Meniere's disease. That's how Meniere's is defined. Is misdiagnosed as Meniere's disease rather than TMD. Inflammation in the inflammation in the joint will cause ringing in the ears, subjective hearing loss, and vertigo. We know it, and because it goes away when you make the inflammation diminish and go away. And of course, migraines. I mean, literally, half the population, half the female population for sure, has migraine headaches. And we don't know what percentage of those actually originate from the temporomandibular joint. But I question, honestly so, I question the validity of migraine because we see so many patients who come in with the diagnosis on medication for migraine headaches. And when you unload the temporomandibular joint long enough to allow the temporomandibular joint inflammation to recede, then their, quote, migraine headaches go away. It's amazing. That study can be done, should be done. We haven't done it yet. But TMD is the world's most misunderstood disease. It is misdiagnosed constantly. And my dental colleagues don't want anything to do with it because they don't understand it. They were never taught anything about it in dental school other than what they're taught in dental school about it. It is a complicated disease because it has a complicated characteristic because it has two motions, a rotation and a translation. Rotate and translate. Gangliomo-arthrodial joint, two motions. Rotation, translation, arthrodial, gangliomo. So the world's most misunderstood disease is a real problem. I'm going to read the first paragraph of the blog that I do every Sunday night on the exact same topic. I think it will make the first part of this a point. If the World Health Organization compiled a list of all the diseases on the planet, TMD, temporomandibular joint disorder, would undoubtedly be on the list as one, if not the number one, least understood disease. This would not be because there is a lack of information about the disease. It would not be because there is a lack of scientific studies on the disease. It would not be because there is a lack of doctors faced with treating the disease. It would not be because there is a lack of patients with the disease. It is because the profession of dentistry was tasked with and given the responsibility of finding the solution for this problem, and the profession of medicine did not want anything to do with it. And dentists and dentistry failed miserably in doing the work and providing guidance toward the solution. It could be summarized as simply lack of interest. This left the development of a solution to those who had a bias for their own treatment platforms. That is why there are so many disparate treatments for the disparate symptoms, because everyone is just biased as to what they know how to do. They're biased on their whatever their treatment is. Surgeons were biased against surgery. Orthodontics are biased against moving teeth around. Physical therapists are biased about doing physical therapy for whatever problem presents to them. So if your only tool is a hammer, everything looks like a nail. And that is what the current state of the situation is in the United States of America and worldwide about this problem, rather than looking at the common denominator, which has been proven is the common denominator of temporomandibular joint disease and creates all of the symptoms. And as I said, if you unload a joint, including the temporomandibular joint, because this joint operates like any other joint in the body, if you unload a joint by a simple device that separates the back teeth long enough, because 90% of the loads on the temporomandibular joint are from the posterior teeth. So you unload the joint, the inflammation goes away, the symptoms go away. It couldn't have been simpler, but there is a lot of pushback from all of the other aspects within dentistry, for sure, and portions of medicine, who have a big stake in treating migraine headaches and Meniere's disease and ear infections. They don't want to hear about it. They don't want to know about it. The dentists who are faced with treating these people, because if a physician or somebody else thinks it might be TMD, better known as TMJ, the name of the joint, temporomandibular joint, their common direction is go see your dentist. And so they go see the dentist, and the dentist says, no, I don't want anything to do with it. I wasn't taught anything about this in dental school other than it's complicated. It has a complicated name, so it must be complicated. That's what they were taught in dental school. True. So that is the state of the situation. And even more interestingly, regarding gnashing of the teeth, which is why I started out with references to the biblical passages that goes on so long, now the dental schools, or some of the dental schools, have brought in psychologists and psychiatrists to work on people to quit gnashing their teeth, because it's well known bruxism, or clenching or grinding the teeth, is associated with anxiety and worry. Anxiety can and does create bruxism. We know that, but we don't know the mechanism. We don't know how it works within the brain. There are theories, lots of theories. We know it has action in the brain, in the lower aspects of the brain, because you are not aware that you are doing it. There are very few people who brux who actually know they're doing it, whether they do it during the day or at night. Certainly while you're sleeping, you don't know you're doing it. You just wake up with sore teeth and sore jaw and other symptoms, headache, earache, jaw pain, neck pain. But you can't talk somebody out of clenching or grinding their teeth. And you can drug them to the point where you totally bury their nervous system, along with all the other side effects that you're going to create by doing those kinds of drugs. And that's what it's come down to, that there are several, I will leave them go unnamed for the time being, of dental schools that are bringing psychologists and psychiatrists in on it, along with physical therapists and orthodontists. But the psychiatrists, psychologists claim they can get somebody to stop bruxing by talk therapy or drugging them. And we don't even know how the mechanism works. So they're going at the wrong direction. Totally wrong direction. So I'll just read another paragraph of Sunday night's blog, see if it makes any sense to you. The dental profession has separated itself by focusing on treating teeth and the structures which support teeth since its inception. Dentists and the dental profession were not used to looking at the mouth and associated structures, including the teeth, as an integral part of the body's systemic system. It's been a problem with dentistry. They've excluded themselves, really, from understanding and the integration of the rest of the body. The orthopedic surgeons, on the other hand, who treat the other joints of the body, are very familiar with how the various systems within the body affects the joint they treat. There's a nervous system that affects all of the joints. There's an endocrine system that affects all of the joints. Dentists, on the other hand, did not have the luxury of thinking how the body's various systems integrate with the structures they treat. Physicians look at the body as one highly integrated structure with several finely integrated systems responsible for health and illness. Dentists, by their nature of their training, in contrast, look at the mouth and associated structures as a separate entity, very different and distinct from the rest of the body. And that is how we got to this problem, because they didn't understand how this joint operates the same as any other joint in the body, and how this joint, the temporomandibular joint, integrates with all of the other systems within the body, and how inflammation within a joint, whether it be hip, elbow, knee, or TMJ, creates a mechanism that, when the joint becomes damaged and inflamed, sends signals to not move that joint, and creates the signals to the muscles that move that joint to tighten up, to become tight, to hold that joint motionless. When it tries to hold the joint motionless, the muscle tightens, it pulls on the bones where it is attached. That creates the nociceptors, pain receptors in the surfaces of the bone, the periosteum of the bone, to be stimulated, creating pain, which can move around the face and the head and the neck, depending on when the signals arrive, what muscles the signals arrive at in different points in time and intensity. And you get the painful, disparate symptoms. The non-painful symptoms of tinnitus, ringing in the ears, subjective hearing loss, that feeling of fullness in the ears, and dizziness, vertigo, are created by inflammatory fluids getting access to the middle ear, which is only 2 millimeters away from the temporomandibular joint, 2 millimeters, and there is a fissure called the petrotympanic fissure in Gray's Anatomy that has been present and known about since 1680, since Dr. Johann Glasser first identified the petrotympanic fissure, also known as the Glasserian fissure, that allows fluid to travel from the temporomandibular joint into the middle ear, where the mechanisms for hearing and the vestibular mechanism to keep us upright are located, creating tinnitus, subjective hearing loss, and vertigo. It could not be simpler. But again, the interest level is pathetic as to both professions actually looking at the basic science of this. And admittedly, it took me giving up a large portion of my practice, which was temporomandibular joint surgery, 2,000 cases over the first 36 years, giving that up and deciding wherever it was going to take me, I was going to see if I could figure out this thing that everybody called TMJ. And it did. And the research wasn't complicated. It did take a little bit. Basically, my patients led me in the direction when they said, if I put my finger, my tongue, a pencil eraser between my front teeth, it feels better. And I went, why would that happen? Why would it happen that if you put something between your front teeth, it feels better? And then I started going down that road, and I started doing some basic research on how things work in the body. And we now know that the temporomandibular joint operates like any other joint in the body. And if you rest the joint, the inflammation goes away, and the inflammation creates all the symptoms. Let me continue with the next paragraph regarding the current state of affairs on TMD in the United States of America. That is the reason that every dental school teaches its students that the TMJ, temporomandibular joint, is unique and unlike any other joint in the body. They teach it operates differently than any other joint in the body. There is no wonder that dentistry made no progress in discovering a solution for TMD when they think the TMJ operates on different principles than the other joints in the body. Dentistry was not familiar with integrating the larger body of knowledge of the systems of the body and allowed treating symptoms to become the unofficial standard of care. So treating symptoms now is the unofficial standard of care. Who cares if the whole process is driven by the pharmaceutical representatives who thrive on the number of drugs they sell, at the detriment of the patients who have to live with the consequential side effects and never-ending expense. That is the state of TMD. So for you patients who have this problem, I empathize with you. If you are looking for a solution, ask your doctor, ask your dentist to go to www.urbanictmj.com, take a look, and see if it doesn't make sense. He can provide this service. You don't have to come and see me. In fact, I'd rather you not come and see me. We are already busy here in Middle Tennessee, and we get patients from both ends of the states and from distant states. I just had somebody come through from Idaho. But I want, if you are a patient, to get a solution for your problem, and you can ask your dentist to go to www.urbanictmj.com, take a look at the information there, see if it doesn't make sense. If they want to do this, they have to be qualified. They have to take a brief course, a 2.5, 3-hour online course that teaches them the nuances of using the device and protocol so that the patients get the same response we get here in Middle Tennessee. This is a patented device. You just can't make it in your own little backyard lab. But if you use it correctly, you'll get the response. And the best way for patients to get response is to get their dentist to learn how to use this device and protocol correctly. There are benefits to all. Everybody's a winner. The doctors who use it are a winner. It can become a large part of your practice. It's very easy to do. It's not complicated. In our practice here in Middle Tennessee, honestly, myself and my associate, our biggest problem is we can't get the patients back once they get their personal nirvana. I'm done, doc. I'm good. I'm happy. I don't need to come back. I don't need to come back for that 4-week interval or that 6-week interval that I'm scheduled to do. It's frustrating because we want to document it. We want to make sure that you get the benefit, that you know how to use it in the long term. But thus getting worked out. All right. So that is TMD, the world's most misunderstood disease. It doesn't have to be that way. For you doctors out there, for you dentists, young and old, who actually want to help people, and there are millions of them who need your help, I ask you to take a look. Take your confirmation bias, and put it aside. And just don't go by the status quo any longer. Be able to look at something that changes the paradigm on treating this problem. It's not complicated. It's not hard to understand. With that said, I invite you to the next time we have an episode of TMD Demystified. It will be on a Tuesday morning. I appreciate you being here. I truly do, both whether you're a patient, a potential patient, person with TMD, or you are a dentist. I hope that you have a successful week. I am Tony Urbanik, and this is TMD Demystified.